The annual wellness visit. Have your patients scheduled their annual wellness visits for this year? The annual wellness visit is covered by Medicare Part B every 12 months at no cost to the patient. The annual wellness visit is similar to the Welcome to Medicare visit that is conducted in the first 12 months of enrollment in Medicare Part B coverage, and it is an ongoing benefit. The annual wellness visit is designed to provide clinical preventive services across all 3 stages of disease development. These include before disease occurs, before disease is clinically evident, and before an established disease has made its maximal impact. The information from the annual wellness visit is used to develop or update a plan to prevent disease and disability based on a patient's current health status and risk factors. The annual wellness visit also involves filling out a health risk assessment as part of the visit. The annual wellness visit also includes updating the patient's medical and family history, updating providers and suppliers of medical care, updating the screening schedule, and identifying current risk factors and their associated interventions, whether recommended or ongoing. Other essential components of the annual wellness visit include updates to the patient's overall personalized prevention plan of service, addressing advanced care planning if appropriate, and reviewing medications and ensuring that opioid prescriptions are addressed. Furthermore, the annual wellness visit is the right time to assess and screen important areas such as cognitive function, substance use disorders, and tobacco use cessation. The following Healthcare Common Procedure Coding System, or HCPCS codes, are used for billing the annual wellness visit. G0438, Initial Annual Wellness Visit, and G0439, Subsequent Annual Wellness Visits. Here are 3 tips to support your patients. Tip 1. Familiarize yourself with Medicare's preventive services to maximize your patient's benefits and wellness. For example, Medicare covers 2 tobacco use cessation attempts per year. This includes 4 intermediate intensive sessions for up to 8 per year. Awareness of these types of benefits can facilitate appropriate referrals and increase access to care. Visit Medicare Preventive Services via the MLN Educational Tool to view information and coverage for approximately 30 preventive services. Tip number 2. You can check your patient's eligibility for an annual wellness visit through CMS's HIPAA Eligibility Transaction System, an eligibility services vendor, or through your Medicare Administrative Coordinator. Tip number 3. Explain covered versus uncovered services as part of the annual wellness visit. For example, while routine vitals measurements are included in the annual wellness visit, other services such as lab testing, radiology, and other treatments or diagnostics may not be covered. Distinguishing between these services for your patients may help them understand what bills to expect so they are not surprised. Remember, an ounce of prevention is worth a pound of care. Make sure your patients are scheduled for their annual wellness visit. For more information on the annual wellness visit, go to cms.gov.